Hello, everyone. It's Friday, September the 18th. Today, I've got 7 additional deaths to report to you, and as it brings our total in West Virginia to 297 deaths. The 291st death is a 69-year-old male from Berkeley County. The 292nd death, a 75-year-old male from Berkeley County. The 293rd, a 91-year-old female from Jackson County. The 294th death, an 80-year-old male from Roane County. The 295th death, an 83-year-old male from Mingo County. The 296th death, an 87-year-old female from Mason County. And our 297th death, a 62-year-old male from Logan County. As you can see again, even though we lost a 62 and a 69-year-old male, both male, but we've lost a 62-year-old and a 69-year-old person, in Berkeley and Logan counties, and all of our other deaths are a few years and considerable years older. Without any question, it goes to every single time I'm here, I tell you that this killer affects our elderly more than any, and we've absolutely got to protect those that have given us wisdom and so much for so long. And without any question, we hate like crazy we've lost an additional 7 great West Virginians. Protect the elderly. Absolutely try to do any and everything you can to see that an elderly person does not contact this terrible killer. It's mighty, mighty tough on the old. It's tough on us all. And absolutely the young can get it. The young can die from it. But the young can get it and absolutely bring it to the old, and it becomes a colossal problem. So, we keep all those in our thoughts and prayers, and we have no choice but to keep moving forward. We had 253 new cases in the last 24 hours. Our daily positivity rate jumped back to 4.85. Our cumulative percent of positive continues to rise and is now at 2.72. Remember way back when we celebrated it dipped below 3, and it's still below 3. But it is every day heading closer and closer to 3. And we do not want that to happen. Our active cases are now at 3,375, which is up 139 cases since Wednesday. We've now got over 10,000 that have recovered. We have hospitalized 175 people. That's up from 156. Our daily effective reproduction number is at 123. It's up slightly. We're at 122 on Wednesday. We're now the second highest, which is bad. We're the second worst in the country. Our county alert map, now has in the red Putnam, Fayette, Mingo, all 3 are new to go red, and Kanawha. In the orange, we have dropped down. In the orange on Mon and Boone County was in orange and went to yellow or to gold, and now they're back to orange. Now, before I go a whole lot further just in this, I want to tell you that we were delighted to see that Kentucky had basically mimicked our color code system. And I have said so many times, in West Virginia, we have been the leaders across the nation, whether it be in, how we first tested all the nursing homes or the assisted living or what we did as far as visitation or what we've now done as far as developing a color code system. So I've got one thing that I should read to you here. real quick, and that is an announcement from the CDC. And let me see if I can find it real quick. The CDC, now the CDC is adopting a color code system that looks tremendously close to our system. Dr. Burks, when she was here, she said West Virginia, that she was leading the practice in regard to this, and that so many people should try to mirror it. First it was Kentucky, and now it's the CDC. And we think we're onto something really good. CDC's color code map shows a lighter green color instead of that basically is somewhat close to our our gold color. We added gold, they added light green. From the standpoint of it uses a 5-color system to represent community spread. I've said this over and over, but it does look very similar to our color-coded system. It does have this. It does have a broader spectrum of an easing in the regulations or whatever they may be in going back to school. So from our standpoint, we have been cautious as we go. And the caution as we go has led us, we hate it like crazy, but has led us to 297 deaths versus thousands and thousands. We are the most vulnerable. We are the oldest. We are the most diseased, and have the most illnesses. And yet we don't have an ocean around us, as I've said so many times. But in all that, and all of our bordering states have shown numbers much, much, much higher than what we're showing. We are within a rock's throw of 2/3 of the population of this country. And in that, we have pitched off really, really, really good numbers. Now, in doing so, I think we did the right thing, and I think we're continuing to do the right thing in being more stringent than what the new CDC's color code system is. And I think we should stay that course and stay more cautious and stay more safe and everything because, frankly, while I'm delighted to see that they're moving as they did in the past in different things that we came up with, that they're moving to this system, I think really and truly their rules are much relaxed to ours, and ours is much safer, and I think we should stay the course of safe. We all want our kids back in school. Good gracious sakes alive. Nobody wants them back in school more than I. Nobody wants them to see our ball teams be able to play more than I. First and foremost, it's school. Secondly, it's our ball team. But more than anything, we want it to be safe for our teachers, our service personnel, absolutely our kids. We've got to be safe for our kids. None of us want to awaken to a situation to where we've got a bunch of kids sick and God forbid, a child die. And so in all of this, we're just doing every single thing we possibly can to make the right moves on this board that is absolutely, completely impossible to know whether this move is the right move or the wrong move, because absolutely it is fluid beyond belief and very, very, very difficult. Now, before I go any further, let me announce a couple things that came out. One was, one is in the Clarksburg Exponent Telegram, that paper there, and it is an editorial in regard to our unemployment rate. And I think it shows West Virginia with the 5th best unemployment rate as we've dropped like month after month. And so that's great news to us in West Virginia, and we're continuing to try to do so, and we're going to continue to try to get more and more people back to work. And I salute Scott Adkins and everything for pumping out like $100 million, or I don't know exactly what the dollar number was, but that went right out, and it's well over $1.5 billion that have gone out. And so but in the last just few days, I think another 100 million went, and those checks, I think, carried with them, a sum total of almost $2,400, which is really good. And so I just think there's been a lot of good work go on, and I salute West Virginia again for being fifth in the nation in this. And if you want to go to that article, it's in the Clarksburg Exponent Telegram, and you can see that editorial in that paper. In addition to that, we've talked about this thing called Game Changers, and there's a big article in the Morgantown Dominion Post right now, and it came out today, and it talks about game changers, and it talks about how we're trying in another avenue to attack this terrible, terrible killer, this drug epidemic that has absolutely captured all of our lives. And I've said it over and over that it can cannibalize all of us. It doesn't matter if you're black, white, rich, poor, Republican, Democrat. It doesn't matter if you're union or non-union. This situation affects every last one of us. Now, in doing so, along the way, we came up with Jim's Dream. It went to Jobs and Hope. We've come up with communities and schools. We're trying to address this problem in lots of different ways. But now the Game Changers people came to me and said, would you be our head coach? And I said, absolutely, I'm all in. I'm all in every way. Our SSAC is in. There's so many different people from the Department of Ed, DHHR, all the people, that are behind this effort, our guard, so many different people. And I know I'm going to forget a bunch, but at the end of the day, I absolutely salute what we're doing in this. And they're going to, this is going up in just no time. And there is thousands, tens of thousands of kids we're going to be able to reach. And hopefully we're going to impact their lives and everything in moving them toward being leaders. I recommend you get this article and read this article. I thought it was really good. Okay. I've told you this over and over and over. We got to make sure that we understand this. From our color code system, there is two different, completely different, independent ways that we can get our numbers and our colors better. Okay, the first one is, we just stop the positive tests that are happening, not stop the testing, but we just get better. We just get more healthy and better. And absolutely, we sit back and we try to treat the situations at the nursing homes or wherever they may be. And we wear our mask, we wash our hands, we absolutely go to church and set pews in between us, and we absolutely do all the right things, and lo and behold, we get better. And as we get better, our infection rate, which is arm left, our infection rate goes down. And as it goes down, our color gets better. Our color code gets better. That's one way. The second way over here is the positivity rate. And it's basically how it works is the total number of tests and the total positives that are done. So basically on this arm over here, which is the right arm, the more tests we do, the more that we'll learn, and the better that not only will be the knowledge, but the better will end up in the numbers, and the better the color will end up. I know it will. So we got two ways. One is we sit back and wear our mask and do the very best we possibly can, and the numbers, if we're really good at what we're doing, the numbers will come down. Or we go over here on this hand and we try to test and test and test and test, is what we want to have happen, because then we're able to have more and more and more knowledge, and we're able to find situations that we did not know that existed, and those people were spreaders, and we were able to help them and get them well and stop them from spreading. And that system of testing and testing more and more and more will be a winner for all of us. So we encourage you. We encourage you in every way. Take advantage. You've got to make the decision, West Virginia. You either go this way on the infection rate, you go this way on the positivity rate and test like crazy. Whichever one is better for you, whichever one of the two is the lowest rating is what you get in the color code system. So if we want the best of all worlds, we'll go test like crazy and give us the opportunity to have either or, and whichever one is best is the color that you get. And therefore it just plain helps everybody because we get a lot more information to where we can help you. So from the standpoint of our testing, at my direction, the National Guard is standing up free testing in red, orange, and gold counties, which is great. Today, we're in Harrison, Mon, Putnam, and Kanawha counties. This weekend, we'll be in Kanawha and Monroe County. Next week, we'll be in Kanawha, Lincoln, Ohio, Mingo, Marion, Cabell, and Jackson counties. And absolutely, we want to continue to, fall back, test more and more and more in Fayette County. Any county that's in orange or red or gold, we need to really put a real push there. But in addition to that, we want to continue to test our yellow and our green counties as well, because the more we test there, the more we keep situations from happening where we get a county that goes green and jumps all the way possibly to a gold, and then jumps all the way into an orange or a red situation. So we're going to continue to test, and we're going to continue to test more and more and more. And to be perfectly honest, if we're not in your county and we're in a neighboring county and you want to go to that county and be tested and everything, I think that's fine too, to go across county lines. Am I right about that? We can go across county lines into testing? Yes. Okay, so if you're in a county and we got testing set up, it's not very far away from you, it's in the bordering county. But be sure, like you said, give the correct address. I know you'll do that, okay? As far as our long-term care facilities, we've got 30 outbreaks now. That's down slightly. That's good. West Virginia has 7 outbreaks in the churches. I think that's down 1. That's in Harrison, Nicholas, Fayette, Mingo, Kanawha, and Wayne counties. You know what I've said over and over about your social distancing there. It's how important that is. Corrections is down to 9 active inmate cases now at Mount Olive. That's good. There are 18 active staff cases, and 13 of those are at Mount Olive. The Guard continues to do additional sanitization work at Mount Olive. Yesterday, members of my administration met with the West Virginia Hospital Association. I met with them myself a couple days prior to that. General Hoyer and Secretary Crouch are going to be on today, and they're going to provide you more information about CAMC's request, as far as a field hospital. We have been in constant work with the Bible Center, and there's been a novel approach and idea that has come about from the standpoint of our private or our Christian schools, and that is this, and that is a willingness to test all the kids in the school as well as the staff, and absolutely, and they, I think, are in complete agreement to be able to move forward with that. We think that's a methodology that can help the county. It can help the public school system. Like I said over and over, there's just so much that we can do in regard to our private and Christian schools. And I surely don't want us to get into a food fight with one another. We want to continue to try to work things through and work things out. I think we're right on the verge of being able to have an agreement between each other that they'll be doing things that'll be really helping our public school arm, and we'll be able to very safely go ahead with guidelines and things that work really well for them. These people do great work, and I couldn't be happier about how we've been able to get together and work on things, and and everything and pull it off. You know, they have many really good, strong points that they make, and I'm going to be open-minded all the time. I want us absolutely not to get in food fights with people. What I want is to be able to constructively work things out to where we have maybe even a model, and that model can spread to other schools and be beneficial to our public and our private schools and our Christian schools as well. That's the best of all worlds. If we can make it work and make it work in a positive way for all, that's the winner. And really and truly, at the end of the day, I've made thousands of deals. You know, when a deal works at its very, very best always is when both sides walk away and they're not completely happy, but they're not surely sad, and both sides are walking away with an agreement. And so that's what we're trying to work through, and we're really close to being finished up, and I think by Monday we'll either have something there or we won't, but I remain real optimistic. As far as our small businesses, you know, we've now sent out 18 million. We now are up to 6,600 applications. That's a whole lot better. You know, September 30th is the cutoff there. You got to really move along, you know, if you're going to get in under the wire on that. From the standpoint of our grants and cities, we're now up to 112,764,000 that have been sent out to 191 cities and counties that have applied so far, or that's what's been awarded. You know, we've still got people that are reviewing everything that comes in, and you know, so the very best of our revenue teams and J.B. McCuskey's great effort and everything, and all those that have been working this in my office and throughout all the guard and everybody else, I thank you. And let's just continue to do it and keep pumping the money out to the cities and counties as best we possibly can. The census, we fell behind Idaho again. Idaho's at 99.7. You're at 99.6, West Virginia. I don't know how you cry about that. You've done really great. Continue to try to, do all you can. If we got anybody else out there that hadn't been counted, make sure they get counted. We'd love to be at 100% counted because nothing would be better than that. But I think that's really all I've got. Again, I ask you to offer up your prayers for those 7 additional great West Virginians we've lost. And I'm very optimistic about, the fact of what Game Changers is doing and the fact that we're the 5th best in the country as far as our unemployment rate today. We want it to keep on going down and keep more and more of our people to work. I'm really happy with, Scott Atkins' work as far as pumping out those checks and everything to all of our people that have been impacted the worst in this and lost their jobs. And I wish to goodness we could have just sent it out on day one, but it takes a little time to get a new system. It takes a little time to make sure and hold us, and protect us as best we can against fraud. So, the monies are on the way, and we're going to continue to make sure that everybody gets their checks and make sure that all works. And I guess the last of my last is couldn't be happier about the CDC. Couldn't be happier about Kentucky. I'm happy about the Bible testing thing, and from the standpoint of how our color code system is, like I said, now we have 4 counties in the red. I think the more we test and everything, and we'll be able to move these counties and move them out of the red, I hope, real soon. And so go out and get yourself tested. It'll give us unbelievable information. That's the thing. If we can get you tested, it will give us information to be able to go right to the point and try to shut this thing down and to really try to really help it. So from the standpoint of the safety of our schools and so on like that, look at the CDC's new guidelines and look at how they've said and how relaxed they are in lots of different ways, and say, go on back to school. We're happy with that and everything. Nobody wants you to go to school any more than I do. But at the end of the day, West Virginia, again, has adopted the color code system and did so with an arm of caution and safety. I can't be more proud than that. And we're going to, this thing, let me end by just saying this. Don't anyone go to sleep at the switch and believe that everything's all right, everything's going to be perfect and everything else. It's not. It's not. There's going to be lots of bumps. There's still room for lots of worry and lots of concern. And what do? We keep trying to address, and we keep trying to move forward, and we keep trying to do the right things. And as those bumps and as those worries and concerns come, or those rough seas come, that's what we're going to continue to do. I'll promise you that with all my soul. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and the governor has really said almost anything I could say so well this morning. I do just want to reemphasize 2 points, and then I will be quicker than usual, which will probably be a treat for many people that are watching. First of all, we know that by doing more testing, we will identify more people who are COVID-19 positive. We'll identify people who are asymptomatic or pre-symptomatic, that 48 hours or so before they will develop symptoms. And we will identify people that, even though they don't mean to or don't even know they're infected, will and can spread that to other people. So testing becomes really the cornerstone of our ability to continue to help make West Virginia a safe place for our residents, make our county safe, allow us to continue to reopen schools and athletic endeavors, et cetera. But the key is a lot of people are hesitant to get tested because of the previous way that we were assessing each county by that infection rate. And what the governor said is so important, and I want to make sure that I'm reinforcing it, that because now that we have a second way to look at each county, and that is the percent positive rate, that we know that the more a county's tested, the better that rate will be, and the more people will identify in that asymptomatic, pre-symptomatic period, so that we can inform them that they're infected with COVID, so that they can protect themselves, they can protect their families, their communities. And that is the way that we'll be able to sustainably open our schools and sports and other activities, continue to keep our businesses open, and do it safely. The second thing I'd like to say is just a comment about the new CDC guidelines to really reinforce again what the governor said. So the CDC guidelines really do suggest, which is exactly what we had done previously, that using 2 different metrics in the way that we did it, both at the incidence or infection rate, and also that percent positive rate is really important for a lot of the reasons that we suggested too. But the other thing I think is really important is they also emphasize there's 5 interventions that should be done in schools, and those are consistent and correct use of masks, physical distancing as much as possible, hand hygiene, cleaning and disinfection, and then contact tracing. And this set of interventions is really what Clayton Birch and the West Virginia Department of Education and the county superintendent and school boards have really focused on. So the combination of the more stringent guidelines that we've adopted, plus these 5 mitigation measures, these intervention measures, these safety measures in school, really do place us above the stringency of the Centers for Disease Control. And I think really do reinforce the idea that we have been on that leading edge as a state, but also that these metrics that we have chosen in collaboration with our public health experts really are really effective measures that we can both try to get people in schools and try to get people back on the playing field, keep businesses open, but really importantly, control the spread of COVID-19 in communities, because the single best predictor of safe schools and safe businesses and all that is our safe communities. And that really is our commitment to each person in West Virginia as we work together to continue to have West Virginia be a place that shines for so many other states. So thank you so much.
Thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Just an update on Wi-Fi installation. We have completed 6 of the 20 sites that the National Guard's adding to support the Department of Education. We've also worked with Department of Education and HEPC on developing a burn rate for PPE and a PPE forecast. As the governor pointed out, significant number of support efforts going on, particularly in Mon and Kanawha County today and throughout the weekend related to testing, as well as Monroe and other counties, and numerous disinfection missions going on. Just wanted to bring a couple points of clarification related to the request out there that had been made for a field hospital. I want folks to understand that a field hospital is outlined to us in the military. If you're talking about a 250 person field hospital, it's about 40,000 square feet of area to install a field hospital. A 15,000 or 50 bed hospital would require about 15,000 square feet. So what we are doing, we fully understand the concerns that are going on throughout the state and in Kanawha County, but I want to make sure folks understand we work daily, DHHR and the National Guard, with the West Virginia Hospital Association to track and address bed capacity, ICU capacity, and those things. We will continue to work with CAMC and others at Kanawha County on what are the appropriate aspects to address needs in those areas. But I want to make sure, again, when we talk about a field hospital, we're talking about a significant piece of real estate. We're talking about 104 medical people that it does not come fielded with, and about 50 personnel from the National Guard or other entities that would have to run the logistics for that type of operation. But also wanted to make sure that people understand that yesterday, Dr. Marsh, Secretary Crouch, myself, and others had a call with led by the West Virginia Hospital Association, with all the CEOs from the hospital organizations across the state to work various issues. Talked about things that will be coming that Secretary Crouch can elaborate on here in a minute related to critical access hospitals and reverse flow, some additional changes that will be made to types of patients at St. Francis. West Virginia Hospital Association's leading an effort with all the hospitals to coordinate staffing, because what we're finding is staffing is the primary issue right now, not necessarily bed capacity. So I'll turn it over to Secretary Crouch to talk just for a minute about critical access, reverse flow in St. Francis and that.
Thank you, General Hoyer. Yes, let me talk a little bit. I'll try to keep this brief. As everyone knows, we partnered with Thomas Hospital in April to stand up St. Francis Hospital as a COVID-19 surge hospital. That's gone extremely well. Dan Lawford, the folks at Thomas have been great partners and continue to be great partners. We understand there's been almost an announcement, I guess, a press release regarding a field hospital. As General Hoyer said, that's a huge undertaking. I think there's been some confusion perhaps with regard to what CMC is looking to do at CMC, which is something much reduced in scale to assist them in terms of patients who in the fall who might have flu, might have COVID, to keep those folks in terms of triaging before they go into the hospital to look at their condition and where they need to go and be directed. WVU did something similar in the spring. So that's different than a field hospital. As General Hoyer also mentioned, we had a call yesterday. We watch these numbers daily. We look at what the needs are with regard to the state and Kanawha County. St. Francis right now, we're looking at standing up a total of 30 beds, which I believe I mentioned last week in a call with the Kanawha Charleston Health Department, so they're aware of that. Though we have 6 patients in St. Francis right now. We have staffing for more, and we're looking at modifying the criteria for what patients we take into St. Francis, and we're looking at providing additional services there so that those patients who do come over have services available. So We weren't contacted about field hospital. We don't know anything about that other than the press release. We couldn't staff a field hospital if a field hospital were approved. So we're here to be available, and a phone call would be great in terms of those kind of things prior to trying to make an announcement about those. At this point, I've again spoken to CAMC CEO today, spoken to CEO Thomas, and we're working together along with the West Virginia Hospital Association to make sure that needs of the citizens are met. Thank you.
Jordan, I would like to, if I could, just to close out. I know folks get frustrated with all of us on the governor's team talking about masks and social distancing and all the things that we're asking folks to do. And some folks believe that's a challenge to individual rights. But I just want to close out with, today is POW MIA Day. There are still 82,000 Americans who have not been returned home since World War II. Sometimes they were not volunteered. They didn't volunteer to go on behalf of their country. They were asked or told to go on behalf of their country. So I think I would just ask all of West Virginians to show what West Virginia is all about, and let's step up and let's make sacrifices for each other, despite what our rights and authorities may be, and do the things we need to do to protect West Virginians out of respect and gratitude and honor to the 82,000 men and women who have not returned home, sacrificing on behalf of their nation. Thank you.
All right, thank you, General, and thank you, Secretary Crouch. We'll now go to questions from members of the media. The first today from David Beard with the Dominion Post.
Hi there, David Beard. The news today about the CDC color chart somewhat alters the context of the issue I want to raise, but I'll raise it anyway because it was brought to me by various people in various manners over the past several days. And just to kind of limit how I ask it, my attention today was drawn to an article in a publication called the Mountain State Spotlight, and featured comments from a Harvard health professor, Thomas, last name is TSAI, who criticizes the way we've tweaked the Harvard map. And his comments in the article overall kind of allege that tweaks were made to achieve certain ends, whether they be political or social. I won't go there. And then second, we have two different maps, the school map and the DHHR map. And the school map was updated today, and I assume the DHHR map was updated today. I believe it's updated daily, but they don't match. And so people say, oh, what's going on with that? Why don't they match? Are those colors and the numbers being manipulated in some way? That baffles them, and they don't understand. So how do you address those concerns?
David, let me say this. You know, at the point in time when we start reacting and we start even considering something that hit job Ken Ward's people would be putting out, we've got to have lost our mind. I mean, really and truly, Ken Ward is just an arm of the Democrat Party that's trying to do anything and everything they can to throw mud, and especially throw mud at me. And if we get to the point in time where we're listening to a man that the Charleston Gazette got rid of and fired or whatever it may be, the Charleston Gazette, you know, as liberal as they come and everything, then we got real problems in life, you know. And but I'd let Dr. Marsh, speak more professionally about from the standpoint of the Harvard model and everything. But Dr. Marsh, if you could join in.
Thank you, Governor, and thank you, David. So I am aware of the concerns of the Harvard group, and to them, we certainly had no intention to take their model in a reckless or any other way. We use it as a baseline because of the respect we have for their knowledge and their group. But we really have now, I think, reached the West Virginia model. And, you know, we've borrowed pieces now from many different public health models, and we've combined those in a way that we feel is going to be good for West Virginia. So I think that the reminder is really good, because we're not just using one model, we're using several models and combining those in a way that we believe will be the best for our state, with its different population counties, being a small population state with some very, very small population counties. So we've really done something, with a lot of thought and a lot of effort and a lot of conversation, that really we feel very, very good, that is quite almost reproduced in the CDC document, with ours being a bit more stringent, as the governor said. And also that other states are starting to adapt the same sort of philosophy, and that Dr. Birx was enthusiastic about where we were going. So all of this is really just back to the same point that we make all the time. This is a generational event. There's no playbook, there's no map, there's no way that you can take one single thing and make it work for everybody. So we are trying to adapt and use the best of the best models and information and guidance we can, so that we help the state of West Virginia and each of our citizens, each of our counties, have the safest communities possible, open up our schools, our sports, our businesses in a sustainable way, which involves getting the community spread down, and ultimately being a place that other people want to come, because we've demonstrated an ability not to fight the virus, not to shut everything down, but to really effectively come up with ways we can live with the virus. And as General Hoyer said, ultimately that is going to be completely dependent on each citizen's commitment to wearing your mask, staying physically distanced, washing your hands, avoiding those 3 C's, and also really, really, really extensive community testing. So thank you.
Me just one second. And I'd just like to add, just summarize just this, is, back when my daughter Jill was in high school, and I've got to mention this too, today's my anniversary, and Kathy and I have been married for 44 years, and she's a great, great, great lady. So Kathy, if you're watching, God bless you in every way. Love comes that way, comes from me in every way. And but I want to jump back to Harvard just one second, because it's a fabulous school and an unbelievable institution. When Jill was at high school and playing basketball, Harvard was recruiting Jill and recruiting her very, very, very intently. And we went there, and we went up to Harvard on a visit, and went through the school, and I was amazed. I was totally amazed and everything, just how great an institution it was and everything, and or is. And so in that, Jill chose to go somewhere else, but with that, so much knowledge and so much good stuff comes from there. But now, but I asked just one simple question. If the Harvard model was perfect, why isn't everybody doing it? Why doesn't our president do it? I mean, if it just is perfect, why isn't everybody doing it? And bottom line is just this simple. Doesn't it have an incredibly good ring to it to say we now have the West Virginia model? The West Virginia model. Maybe it doesn't have the prestige yet, as Harvard would have. But what I want to see is the West Virginia model on everything. I want to see West Virginia grown, West Virginia model on this, West Virginia model on that. Isn't it amazing that with all these great experts and everything else that we do have a West Virginia model? We're not just sitting back on our butts, and we're just taking something and saying, well, let's just go with this, or let's just go with this. People are working, and people are trying to make it better and better and better. The other thing I would say is just this. I loved what General Hoyer just said. We oftentimes don't want to do something because we don't think that's, we have a right to not do something. And when he said 82,000 I think it was 82,000 have yet to come home. And a lot of those went there, not by their choice, but because they were drafted and absolutely almost just pulled off the street and said, you've got to go and you've got to go right now. And they went with honor, and a lot of those still haven't come home. Now, if we in this state and in this nation can't, out of respect and love for them and your neighbors and everything else, maybe it's just something that you just don't quite like. So what? So what? Out of love and respect for those that we lost, that haven't come home, out of those that are great neighbors and everything else, just come on. What's it going to hurt? I mean, are we asking too much to say, well, we're going to put a mask on while we go in a building? I mean, is that painful? And if you've got a medical condition and you can't breathe or whatever like that, we said we're good at that. We're good with that. Excuse all that. And we know, I spoke the other day to a gentleman that was one of the leaders from the country of India. And you know what he said? Here's exactly what he said. He said, if the people of America would just wear a mask all the time for a couple of months, this whole thing would be gone. And look at the places, whether it be Taiwan or whether it be all across the world, that have done just that because they had more discipline than us. They had more discipline than us to do it. Now, we're trying to fight through this and keep everybody's rights and do everything we possibly can. And I'm all for it. I'm all for continuing the battle. But there's so many aspects of this that could make it easier and make it better on all of us. But the bottom line that I love to hear the ring to it. If you could just close your eyes and think, West Virginia grown, the West Virginia model, the West Virginia. Doesn't it have an incredible, incredible ring to it? And so as we go forward, we're going to show the world, we're going to continue to show, but we're going to really show them just how smart we are, how many great experts we have, what craftsmen, what low crime, what great people that we have, what unbelievable beauty. We're going to want people, we're going to have to run them out of this state because we're going to have lots and lots of people come.
All right, next we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. You guys kind of touched on this earlier, but I want to dig a little deeper into it. Charleston Area Medical Center wants field hospitals or extra space set up. And we've been trying to talk with CAMC about why specifically they're asking for that, because it doesn't look like capacity is a problem, especially with St. Francis able to take, I think you guys have said, up to 65 cases. So it looks like it's more of a staffing problem. The CAMC famously refuses to let us know what their staffing situation is, i.e. numbers of people who are infected, who are quarantined or isolated, who actually work at the hospital. That might give us a better idea of what actually is going on. So one, is CAMC communicating with you at the DHHR or the governor's office or the National Guard? How many other staff members are actually impacted by COVID, and what are those numbers? And the second thing is General Hoyer, if you could dig a little deeper into this field hospital thing, just how difficult would it be to set up a field hospital under the regulations that you have to follow to make the thing actually function? Thank you.
Okay, let me touch on it just a second. I'll be real short and brief. I do think that we've got several people, that at the hospital that have fallen ill in some way, related to COVID, and so we've surely got a staffing issue to some degree. But Kenny, before the general speaks, I want to just say this: I know that we have hospital capacity, at different places that is surely adequate for the situation that we have today. And from the standpoint of throwing up a field hospital today, I just don't think that today that there's probably that need or that we can accomplish, just that idea today. Now, but I can say just this, that the very second that those medical experts come to me and say, Governor, we're approaching some level of criticalness that we need to look at a field hospital or whatever it may be, I'll promise you within seconds that I'll be on the phone with the President of the United States. So all they got to do is come to me and say, Governor, we think we need to be moving in this direction and move in a more heightened state of alert. I'll promise you without any question whatsoever, I'm on the phone, we're working, we're going to bring in all the king's, men and all the king's horses, and we're going to go, but right now that's my thinking, and I don't think that the medical team is going to recommend, nor do I think that we have a need from the standpoint we have the bedding, we have the hospital capacities and everything, I think, to handle everything that's going on. But anyway, General and Dr. Marsh, maybe, or Bill Crouch, y'all can weigh in.
So Kenny, related to the specific structure piece, I think, as I mentioned, if you're talking about a 250-bed field hospital, you're talking about 40,000 square feet, appropriate drainage, appropriate electrical, HVAC, all those things. A 50-bed hospital is 15,000 square feet. So if you were looking in the context of what we would need to do, you'd probably have to look at some place like the Civic Center would be more appropriate to set up. And you saw that happen in New York in two different circumstances, one inside a structure and one outside a structure. A 250-bed hospital takes about 104 medical staff and about 50 logistics and support and maintenance staff. So what we again have looked at is looking at those things that Secretary Crouch talked about earlier, reverse flow and those types of things in conjunction with the Hospital Association and all the CEOs of the hospitals. We are going to work cooperatively with Kanawha County Emergency Management, with Dr. Young and CAMC to see what the needs are related to maybe a small structure to do triage that might be needed going forward to help out with things like that. As Secretary Crouch mentioned, and he can elaborate on a little bit more here, the West Virginia Hospital Association is aggressively working with all of its members related to concepts to better address staffing as well as traveling staff and things that, because right now there are some challenges with staffing related to folks having to quarantine. And I'll turn it over to Bill to follow up on that.
Yes, thank you, Kenny. It actually is an excellent question. There is confusion out there. There's been a couple of press releases and information out there. We need to try to clear that up this afternoon, and I will have further discussions with CEO of CAMC and with Thomas. But our plans involve not only St. Francis, but we have a hospital up north at Fairmont that we're prepared to stand up if we need to as well. So we have additional capacity there. We also have critical access hospitals throughout the state. We have 21, 22 of those that we can use as additional capacity should that need arise. So we're really looking carefully at this daily. As General Hoyer said, we're having discussions with the Hospital Association and the hospital CEOs of the state. We really believe at this point a field hospital is not necessary. There have been discussions, as I said, with regard to CAMC having a tent put up to take care of flow and triage prior to patients entering the hospital. And again, WVU did that last year as well. In terms of outbreaks and staffing, you're right in terms of the information there as well. We do have outbreaks in hospitals and we have outbreaks at CAMC right now. So those those staff are immediately quarantined or sent home in all hospitals. We've had hospitals in various counties that have had staff who are positive. they're very good about making sure those staff are removed from the facility immediately, or actually get sent home from the facility immediately to isolate. So well, I think all of those things you brought up are important. I believe we're on top of all those things. We'll clarify this afternoon. We'll talk to everyone and make sure we clarify and get information out that explains what the plans are. So thank you.
All right, thank you, Kenny. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor. On Wednesday, I asked about the EMS rule, emergency rule that was made by DHHR. And after asking that question, I got sent a letter from the EMS Coalition. And they had essentially their problem is that they feel they're being unfairly kind of targeted, EMSs, when they feel that they've been wearing masks and taking appropriate actions, even more appropriate actions than is in the rule. And so I just wanted to allow Secretary Crouch a chance to respond to this letter, and the notion that maybe this was inappropriately placed in legislative rule, and just kind of why it was done the way it was done. Thank you. Okay,
Secretary Crouch, go.
Yes, Governor, thank you. Yes, we did modify the rule to require EMS individuals to wear a mask when they're out on a call. The reason for that is we have reports of EMS folks not wearing masks on a call, and those folks are critical to our emergency management structure in the state of West Virginia and the responses that we need. So I understand they're upset about that. There was a reason to do that, and we believe it's important, and I stand by that change in those rules. We've had outbreaks in police stations. We have 2 in Kanawha County. The one in St. Albans is now over, given the time frame. We have another one in Charleston. I believe it's 8 police officers who are positive. Our first responders, and fire departments, by the way. So our first responders need to wear their masks. They are part of our system in West Virginia to keep people safe and to keep citizens safe. So I urge everyone, all of our first responders out there, to wear your mask. Having a rule that requires the mask to be worn by folks who are now saying we wear our mask and we don't need a rule. If you wear your mask and you don't need the rule, then the rule will have no impact on you. So again, this is important. Our first responders are important to us. We want to keep them safe. We want to give them all the PPE they need throughout the state. And if anyone is short of PPE, let us know. General Hoyer is the first one to say he'll drive it to those folks directly. So again, we're trying to make sure people are safe.
All right, thank you, Taylor. Next to Paul Mullen with WCBC.
Good afternoon, Governor. 44 years. Congratulations on that. And perhaps Major General Hoyer has a medal for your wife. The situation that we have coming up here in the mountains tonight, we're looking at 38 degrees. And I know we were hoping that the virus would maybe settle down a little bit when it got warmer. It didn't quite happen that way. With cooler weather on the way, perhaps Dr. Marsh could answer this. Do we have concerns that it's really going to ramp up as we get into the cold weather?
Paul, let me lead off by saying you're right. God bless Kathy, that's for sure. And and a medal, she deserves probably a whole lot more than a medal. But and as far as Dr. Marsh, commenting or whatever on the 38 degrees, it just seems almost impossible to think that the summer's gone and now it's fall. We just turned around and spring left and then summer, and and it's been a long spring and a long summer for a lot of West Virginians, and I go back to those families that we've lost. 297 great West Virginians. Please, again, keep them in your thoughts and prayers. It's been an exceptionally long summer and spring and early fall for them. But Paul, I appreciate your kind comments about Kathy. I can't understand you getting on me so bad and everything, but and I only say that teasingly. And General or Clay, if you could comment on the 38 degrees. you know, it's too early. It's too early for fall to be here. We'd like to have, you know, a beautiful fall, early fall, and everything warm and everything with the leaves turning and everything be really pretty.
Well, thank you, Governor. So I think that that's a really interesting and important question. We know in looking at data from last year, and we know that in the United States, the COVID pandemic came a little bit late in the influenza season, but we did see some reductions in certain places with influenza because of the mask wearing and the physical distancing and the hand washing. So this is a really good strategy to reduce the spread of influenza as well. And that becomes even more important about the sort of those interventions and those personal behaviors that really make a difference. We do know, though, as people go inside and are closer to each other, that does make the risk of COVID-19 spread. So we are very concerned about the fall, winter time coming up, influenza coming on, you know, people coming together. So this is probably the most important year that we've had on record in this generation to get your flu shot. Getting a flu shot is so important because separating influenza and COVID-19 are really, really difficult. But getting a flu shot is protective. And then just adhering to the strategies that General Hoyer talked about and the governor's talked about, and we've talked about a zillion times: wear your mask, stay 6 feet apart, wash your hands, avoid crowds, avoid indoor closed spaces, and avoid being around people for 15 minutes or greater that in a sustained way that you don't live with. And you'll be protected not just from the spread of COVID-19, but from other respiratory viruses that we'll see in the winter as well.
All right, thank you, Paul.
I want to come back just 1 second. Paul, one last thing too from my side. This is the governor, but and I want everybody to hear this and everything. There's no question that the fall, the winter brings the flu season. There's no question that the flu season compounds this situation, and we urge everyone to go get your flu shots. But fall and winter, at least for right now, bring a real level of hope to me too. A hope for that vaccine. That vaccine, we get closer and closer every day to that vaccine. So from my standpoint, I am welcoming fall and winter, even though I am very, very concerned naturally about flu and all that, and we want to take our shots and we don't want to compound, but at the same time, every day that goes by, we're close. We're getting closer and closer and closer to shutting this thing down. And so fall and winter right now bring a lot of hope to me. So and I want us all to feel that way too.
All right, next we'll go to Mark Curtis with Nexstar Media. All right, we're having some technical issues. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you mentioned how our cumulative testing rate is approaching 3%. And given what an important benchmark that was in our reopening process, what do you plan to do when we inevitably reach that 3% point? Will that trigger any further restriction? What will that actually mean to hit that?
Well, Charles, we're having lots and lots of discussions about that, what that means. But if we get to 3%, Charles, we will absolutely have to look very, very seriously about starting to take more aggressive actions and everything. I hope and pray we don't get there. But Charles, we're prepared to take significantly more aggressive actions if we do get there. And so, I'm hopeful that we're going to be able to get a lot more testing that's going on, a lot more information, a lot more our ability to be able to attack and to be able to go at the roots of these problems and everything and stop it. But the net of the whole thing is Charles, we're watching that number really closely. It was an indicator to allow us to start easing off on restrictions, and as we approach that 3% level, we'll have to look at greatly restricting situations.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. My question for you goes back to hospitals and potential community spread. Is there any plan to come up with a way to track those cases with hospital workers like we are tracking in the jails and nursing homes? And then also, I know there is some sort of issue when it comes to paying people who work at hospitals for time off to encourage testing. Is that been any part of your discussion with the hospital CEOs? Thank you.
I'm going to go to Dr. Amjad with this, but from my standpoint, you know, we should do any and everything we possibly can nonstop to try to reward and to help the people that have been the heroes beyond belief, and that's the people that are out there on the front lines. So I am all in all the time to try to do any little extra or any significant thing that we can do to help those people. But Dr. Amjad, if you'll go, please.
Hi, Amanda. As far as keeping track of the hospital employees that are testing positive, there's contact tracing that keeps track of them, and of course, whatever hospital system they're working in, they usually have some mental health counseling involved, and of course, their physicians, their private physicians keeping track of them. But I do know a lot of them do have mental health counseling involved with that. I've seen that either online or talked to them myself. But they do that. As far as any compensation, there is some, I don't want to say it's CARES Act funding, but there is ways they are being paid if they're taken off of work for that. But those are individualized depending on what hospital network they're working with. So there is things like that is involved, but there is a lot of mental health awareness, COVID fatigue. People are tired, they've been working long hours, but there is a lot of that that's taken into account. But as far as tracking goes, that contact tracing is what's being tracked with that. As far as any other studies going, I don't know if anything locally, Dr. Marsh might know, or Clay up at WVU if they're doing that. I don't know anything about that personally at this level.
Yeah, I guess the only thing I might add is that I think that through the hospital association and the leadership teams with the CEOs of the different hospitals, we have continued robust discussion around not only what's going on at a individual hospital or health system, but also how we can start to work together to make sure that we are all supporting each other in the state, to make sure that that the hospitals have the capacity, the personal protective equipment, and the planning, including any infection control epidemiology that they may need to be able to protect the people in the hospitals, but also the people that work at the hospital as well.
All right, thank you, Amanda. Governor, back to you.
Okay, I really don't have anything else to report today, except I just want to say just this. And I want every West Virginian to know I'm looking right at you. I know these are challenging times for all of us, aren't they? And I know that absolutely you are bombarded with all kinds of different solutions or whatever it may be. Just do one thing for me. Just absolutely know how good you really are, how good you've really been. And absolutely know we're going to get through this, and it's going to be okay and everything. Say bunches of prayers for all those that we've lost and all their loved ones and all their family. But absolutely know, West Virginia, that you've got to do one thing, and that is you have got to be super proud of you. I mean, you have done so much good for so long and been so unnoticed. Absolutely continue in every way to just be you, because the world is getting it, and absolutely you're the best of the best. I could never be more proud. My dad would have said in the Air Force, a lot of times they said this, it's been an honor flying with you, and it has been an honor beyond belief. I am so, so proud of you. Thank you so much for making me feel good. Proud of you, West Virginia.